House enters the conference room and demands a high-level spinal block for a patient suffering from migrating pain. He specifies the use of lidocaine to sever the neural connection at the brain stem level. Cuddy refuses the request, citing the immediate risk of total respiratory failure and permanent paralysis. House ignores the administrative protocol. He argues that the pain is either a physical reality or a signal generated by the brain. To prove his theory, he must effectively separate the patient's head from his body. The logic is binary. If the pain remains after the body is numbed, the brain is the source of the malfunction. If the pain stops, the body is truly diseased. House corners the patient in the operating room. He bypasses standard diagnostic imaging and prepares a long-gauge needle. The patient sits on the edge of the table, exposed and trembling under the surgical lights. House injects the lidocaine directly into the upper spine, inducing a state of temporary neurological isolation from the neck down. The medical team monitors the vitals as the patient's lungs begin to struggle for air. House watches the patient's eyes, searching for a reaction to the sudden loss of sensation. He applies sharp physical pressure to the paralyzed limbs, testing the integrity of the nerve block. The patient gasps, caught between the threat of death and the hope of a diagnosis. The results return an ambiguous value, yet House remains unmoved. He treats the human nervous system like an electrical network, willing to risk a total failure to find the error. The team watches in silence as House completes the experiment, proving that for him, the patient is merely a data point in a cold calculation.
Dana Miller, a world-class cancer researcher, abandons her laboratory to work in a professional kitchen. During a training session, she suddenly collapses. Her lungs deflate, and her liver begins to bleed internally. She is rushed to the hospital, where the medical team suspects a hidden malignancy. They place her in an MRI machine, using high-powered magnets to scan for tumors. Every test comes back negative, but Dana's condition continues to deteriorate. She begins to complain of an unbearable, deep-seated itch inside her head. During the night, Dana falls into a restless sleep. Driven by a phantom sensation, she begins to claw at her temple. She does not stop. By morning, she has scratched a hole directly through her bone. Doctors find her with blood under her fingernails and brain matter exposed to the open air. The team is paralyzed by the sight, unable to explain why a patient would dig into her own skull. House notices a specific detail in the medical waste. The nurses gave Dana pads because she was bleeding too heavily for tampons. He tracks the timeline back 8 months to a surgery for a uterine myoma. During that procedure, endometrial cells escaped into her bloodstream. These cells traveled and attached themselves to her lungs, her liver, and her spine. Every month, as her uterus sheds its lining, these displaced cells do the same. Her organs are menstruating. The pressure from the bleeding near her spine triggered the neurological itch. Surgeons remove the ectopic masses, and the internal bleeding stops. Dana survives the most violent physiological cycle on record.
Cuddy brings her baby to the hospital after House manipulates her childcare. She retaliates using administrative power. House returns home to find his apartment dark and the heat cut off. Cuddy has informed the utility companies that he is moving. House spends the night shivering under a thin blanket on his office sofa. Wilson finds House the next morning. House refuses to escalate the conflict. He explains his strategy. He will let Cuddy have her vengeance until she is satisfied. He believes the only way to end the war is to lose it. Wilson suggests House feels guilty about the baby, but House ignores the sentiment. He remains focused on his physical discomfort and the medical case at hand. The environment remains hostile. House enters the lab, deprived of sleep and heat. He dismisses his team's prying questions and focuses on a patient experiencing spinal shocks. He meets Cuddy in the hospital corridor. He stops her with his cane and analyzes her behavior with clinical detachment. He notes that her hatred from the previous day has shifted toward emotional vulnerability. House delivers a cold assessment. She was a mediocre administrator before the baby, and she will be worse now. This blunt statement serves as his acknowledgement of her new reality. Cuddy admits the retaliation provided a necessary release. She stops the elevator and stares at him. The power at his apartment is restored. They reach a stalemate, returning to their established pattern of mutual provocation and professional necessity. A priest reports seeing a bleeding man in his room. House dismisses the vision as a neurological glitch and orders an EEG to monitor brain waves for epilepsy and a CT scan to locate tumors. The tests return normal results. The medical team suspects the priest is faking symptoms to secure a hospital bed or drugs. House refuses to accept their skepticism. He fires Foreman and 13 after they challenge his medical authority. The diagnosis remains a stalemate until a physical symptom emerges. During a routine examination, the priest mentions his foot feels numb. A doctor removes the priest's sock, and a necrotic toe detaches and falls to the floor. The room goes silent as the doctor picks up the blackened bone. House updates the whiteboard. Hallucinations, necrosis, chest pain, and blindness. No known infection fits this pattern because the patient's white blood cell count remains low. House stares at his remaining team. He uses the logic of an 80s rock band, Duran Duran. He explains that if a band is playing but there are no fans, it does not mean the band is gone, it means the fans are dead. He realizes the lack of white blood cells is the evidence of a total system failure. The priest has Wiskott-Aldrich syndrome, a rare genetic defect. His immune system is non-existent, making his body a target for every minor bacteria. The hallucinations were caused by alcohol reacting with his failing organs. House sits by the bed and delivers the final verdict. There is no divine intervention, only a lethal error in the priest's DNA. Father Daniel Bresson lies in a hospital bed with hallucinations and skin lesions. His medical history reveals frequent transfers across New Mexico, Wisconsin, and New Jersey. These moves followed a 4-year-old accusation of child molestation. The medical team suspects Bresson has AIDS. A positive result would provide the physical evidence needed to confirm the sexual assault allegations and a broken vow of celibacy. Dr. Taub finds the accuser, Ryan, working at a diner. He tells Ryan that the priest is dying and likely has a contagious immune deficiency. He instructs the boy to get tested immediately. Ryan returns to the hospital and stands at the entrance of the intensive care unit. He watches Bresson struggle for breath. The priest questions why he must endure this suffering after years of public shaming and social exile. The team completes a genetic scan. The results prove Bresson does not have AIDS. He has a rare congenital condition that mimics the symptoms of an immune collapse. The biological proof of his guilt vanishes. Medically, the priest is innocent of the charges that ruined his life. The diagnosis clears his name but cannot restore his lost years. Ryan stands by the bed as Bresson reaches out. The priest places a hand on the boy's head in a final, silent gesture. The truth is confirmed in a lab, but the damage to Bresson's life and faith is absolute. House stops breathing. His team finds him slumped in a chair, lungs paralyzed by a massive dose of methadone. They hammer on his chest until his heart restarts. Wilson realizes the truth. House is using the powerful narcotic to kill his chronic leg pain, once and for all. The pain-free House is unrecognizable. He walks without a cane. He is polite, patient, and dangerously agreeable. When the parents of a young boy demand an MRI, House ignores his usual skepticism and grants their wish. He wants to maintain his newfound peace. The decision is a catastrophe. The contrast dye used in the scan destroys the boy's weakened organs, leading to total liver and kidney failure. A patient is dying because his doctor felt too good to say no. Dean Cuddy delivers an ultimatum: give up the methadone or lose the job. House chooses the drug. He packs his things, ready to abandon medicine for a life without agony. But the realization hits him in the quiet of the lab. His misery was his filter. Without the pain, he is just another mediocre physician making fatal mistakes. He traded his diagnostic edge for a dose of comfort